how is NTM lung disease diagnosed? The diagnosis for NTM, non-tuberculous mycobacterial lung disease, is not difficult, but it does require familiarity with NTM lung disease. The presentation generally involves signs and symptoms that are nonspecific. That is to say, not specific just for NTM lung disease, but may overlap and be similar to other lung conditions, including bronchiectasis, chronic obstructive pulmonary disease, COPD, asthma, or other lung problems. The most common symptoms generally involve cough with or without sputum production, fatigue, fever or sweats, shortness of breath, chest pain, weight loss, or even coughing up blood. Not all these symptoms need to be present simultaneously. Because NTM lung disease may be associated with other lung problems, including bronchiectasis, COPD, and asthma, we do need to do tests to sort out whether the presentation and symptoms are in fact related to NTM lung disease and or one of the other lung diagnoses. Specifically, we often collect several sputum samples for culture, either by spontaneous production or with nebulized hypertonic saline. In those instances when patients are unable to provide sputum samples, we may do a procedure called bronchoscopy or BAL, bronchoalveolar lavage, where we look down with a fiber optic scope into the lungs and do a washing to check for these organisms. Other tests required include a chest CT scan, and other tests also generally include pulmonary function tests and blood work. With prompt evaluation, an efficient diagnosis of NTM lung disease when present can be made, and effective management started.